This conference will now be recorded.
Very good. Okay, so let's go right here. All right, folks. So we last class, as far as when we were doing our remote class on Tuesday there, I ended with this slide, and I'm just going to review it again regarding prevention of pregnancy and such. And so these are what we would say would be like 3 methods, right, that don't require anything as far as any type of devices and such. Understood? And we get it. This is pretty simplistic and such as far as abstinence. We know what that is, as far as just abstaining from any type of sexual intercourse, any type of coitus. As far as the rhythm and the withdrawal method, so the rhythm method, a little bit more effective than the withdrawal method, and we talked about that as far as knowing that the withdrawal method, things can happen, and many people have gotten pregnant as a result of practicing the withdrawal method. The rhythm method, a little bit more as far as going through the cycle. We looked last class and we talked about, and let me go back to a slide here for a moment, just as a review for you all regarding the ovarian and uterine cycles. Oh my gosh, when I do this, this kind of gives me like the dizzy kind of a thing going on. Holy cow. Let's see here. All right. So as we're looking at this here, so we're seeing the ovarian cycle, we're seeing the uterine cycle. And again, knowing that they both coincide as far as the 28-day cycle, and understand that really many women do not have a regular cycle as far as at 28 days. So some can, and really we talked about that, the fact that it's really the first half that can vary from 14 days, maybe a day or two less or a day or two more, but it's always the second half, once ovulation has occurred, that it's 14 days. Okay, just so that you know that. So there are variations within our genetic makeup, right? And so this goes for male and female, but as far as for the female reproductive cycles, that's what's taking place as far as for a fertile female. And we talked about how ovulation is when that mature egg is leaving, right, the ovary. It's expelled, it's released. And recall that remember I showed you the fimbriae, those like little fingers that act to catch and to guide the egg into the oocyte, also known as the oocyte, into the fallopian tubes, or we would also call it the oviducts, right? So those are common uterine tubes, some common names that we would talk for those structures. And this is where fertilization can take place. So if there is coitus and the sperm are released into the female reproductive system, then a few hundred can travel and get into the fallopian tubes and enter and possibly then interact with the egg, and fertilization can take place in the fallopian tubes. Remember, we said that fertilization takes place there, but not implantation. It's the uterus that is prepared. And so as we look at this chart here, remembering that the uterus gets thicker in the second half, right? It's beginning to, and it gets thicker and thicker and more vascular. So you're seeing all blood vessels here. And so this is preparing for the implantation of a fertilized egg. Okay? If there's no fertilization that takes place, then that yellow body, which is releasing hormones, progesterone, estrogen, right, in order to, that's really sensitive, in order to maintain that thick lining, right, of the uterus. No fertilization takes place, then what happens? Bleeding occurs, and that's the first day of the cycle. That's day 1, okay? So you'll see here that progesterone and estrogen levels, they drop, right? So those important hormones drop that help to maintain that thick uterine lining. And so we said what? Look at here. We show that this layer, that functional layer of the uterus, that's what sheds. And it's highly vascular. You see the red and the blue? That's the vascularity of that. And so that's why the bleeding occurs as a result of those blood vessels being shed and that layer being shed. So Yeah, so very important to kind of to keep in mind and to remember that. So the portion of the cycle where you can become pregnant. Well, if the egg is not released, can you become pregnant? No, because the egg is not released. So how could fertilization take place? So really understand that here, first half, that's not going to happen. Can there be some sperm that's left over for a short period of time before ovulation takes place? Yes, but really the chances are pretty low. But even still, you know, if you're wanting to prevent pregnancy, just the rhythm method and the withdrawal method, really, it's not really the thing to, you know, you could, so what'll happen is that people will use multiple types of birth control methods just to be sure, right? And so that there's wisdom in that, and that's pretty smart. Okay, so let's get back into the PowerPoint to where we were starting at there. So let's go here. Very good. And so then let's move to the next slide. So surgery and barrier methods, the most effective, right? And so know that with surgical methods that can occur, you still have to be careful for a period of time and making sure that, you know, everything went well. And so the recommendations are, and I don't recall, I have to look that up. I forgot to, you know, kind of comes and goes, but I know that like for vasectomy, so you'll see here vasectomy, right? So the vas deferens, also known as the ductus deferens. This is the tube, right, that would carry the sperm from the testes, right, and the epididymis where they mature. That's what the muscular tube that carries them to and out of the body. So it brings those sperm to the urethra, and they interact with the ejaculate, which would be the secretions from the prostate gland, from the bulbourethral glands, and from the seminal vesicles. Right? All of those secretions mix with the sperm. So if we cut the vas deferens, tie it off, will the sperm be able to get into that area there and mix with that and exit out of the body with the ejaculate? No, which is a good and positive thing, right? And so know that. So then you think to yourself, well, what happens with the sperm that's being produced? Because you're not stopping sperm production, right? So we're not removing the testes, because if you did that, then you'd have issues as far as with hormone production. So we're not, remember that the testes and also the ovaries produce hormones. Very important for the human body, right? So we're not removing those, although that is a situation in the case of like a castration of an animal, right? That they would actually remove the testes, and then you're not having the factory that's synthesizing and producing the sperm. But in the case of a vasectomy, you're just cutting tubes, right? So you're just doing plumbing. And know that this can be reversed, right? So this can be reversed, because how about someone is with a partner and maybe they have a kid, or maybe they just don't want children, right? And so he has the vasectomy, they wait a few months, everything is good, so they don't need to use birth control. But so they do tell them months, folks. You need to know that it's months. I don't remember how many months. Okay, yeah. So I know that they really want you to be careful and be safe, and thank you, appreciate that. But then as far as like for the female, instead of having a hysterectomy, again, where we're removing structures that it's an operation that's pretty invasive, right? Whereas with like the vasectomy, we're just cutting a tube. It's pretty low key, and it can be done in office procedure. The tubal ligation, they're going in and they're just, again, preventing the egg from entering into the tubes in order to allow for fertilization to possibly take place, right? So again, it's just cutting tubes and tying them off or cauterizing them and making sure that they're not able to have. And remember this, right? So we talked about the terms gonads. Gonads are, so gonads would be the testes and the ovaries. They produce, in addition to hormones, gametes and hormones. The gametes are the sperm and the egg, respectively, for the testes and the ovaries. Right? So you need to know terms: gonads, gametes, and then the hormones that these. Actually, sorry, I apologize. So, well, yeah. So the gonads are producing the gametes, and the gonads are producing the hormones. Okay, very important as far as for reproductive issues are concerned. You'll see here that spermicides. So if it's spermicidal, so if we say that someone is homicidal, right? They want to kill somebody, right? Bad thing, evil. But spermicide, what's it going to do to the sperm? It's going to destroy the sperm, right? And so sponges, contraceptive sponges for the female, condoms for the male, can both contain these chemicals. So that can be one additional situation that can help with the whole pregnancy, as far as preventing pregnancy. But know that, like, you just got to be careful. And some people can have reactions to these chemicals and such. I mean, chemicals are not just inert, meaning that they're not just, they do their job and they do nothing else. Right? You understand? Like, so some people can be allergic, and some people can be very sensitive to them. And so, yeah, it's one of those things you got to be careful. So maybe doing two barrier methods as far as using a sponge as well as using the condom. These are things that you have to decide what's going to work for you and your partner. And that's where I have to tell you, right? No matter what relationship, if you're having that much of an, and we know that we get this, it's an intimate relationship. So there always needs to be communication, right? I mean, to have a healthy, positive, good relationship between you and your partner, right? There always has to be communication. And so this is not something like when years ago, so with my grandparents and even with my parents are 79 right now, both of them, and my great-grandparents, which have all passed away. I mean, in those generations, you know, they didn't, I mean, people have been having sex since the beginning of time, as well as animals and people, right? But in those generations, they weren't talking about it. They were doing it, but they weren't talking about it. Honestly, they weren't talking about a whole lot of much of anything. I remember my great-grandparents, and I loved them dearly, but you know, it was just different. You know, now, I mean, we realize, like, hey, there has to be a good communication. Hey, for so intimate, at the most intimate level that two humans can be at, we better be able to talk with each other and talk things out. And hey, these are issues that can produce a child. So we would want to, if you're not at that stage and ready for a child, then we need to talk these things out, and not just, and you know what? And not just say, well, he's taking care of it or she's taking care of it. No, you both, if you're both involved in this relationship and in what goes on as far as coitus, you should both be involved with talking about and discussing and figuring out, well, what are we going to do about this? And know that also, right? If you're active in such, you know, making sure that, you know, you get tested and to protect each other. Oh my gosh, I have thoughts of people that I know personally, in family and such, and in life over the years, and in patients who ended up coming down with different sexually transmitted infections. We call them STIs now instead of STDs. But you recall, you probably heard that term, STD, sexually transmitted disease. Now we say sexually transmitted infections because that's what's going on. It's whether it's a virus or a bacterial, which many are bacterial, and we have medication that can help with this. But you got to find out and figure out if you have something, if there's an issue. But anyway, we don't want to transmit these different infections to each other, and you don't want to come down with them. And then not treating them leads to bad consequences, folks. Really bad consequences as far as, hey, so, you know, you're at a certain age now and you're sexually active and you get an infection, and you don't realize the signs, and know this, that some of them don't have any signs whatsoever for a period of time. So you could be asymptomatic, no symptoms, yet you still have an infection within you. And this infection could cause problems as it grows and gets bigger, and to the point where then you might become sterile. And so issues with affecting your ability to have children down the road if you so choose. Again, people's minds change over time. And initially they're like, I don't want any kids, and it's not me. But then, hey, maybe you meet another partner, and maybe that's something that you would choose. And then I know of people who are sterile as a result of they're not able to have children because of untreated issues, or issues where it becomes even worse, the sexually transmitted infection, where it becomes pelvic inflammatory disease, where it affects the whole inner reproductive system. And how sad, folks, really sad, seriously. So, something to really, these are important things. To be honest, right, it's uncomfortable for me to say these things, yet I understand, and from clinically, right, as far as a doctor and such, I realize that as much as it's uncomfortable, I would rather say these things to you all to make sure that, you're okay. Yeah, we want you to be okay. We want you to be safe. And so, thinking all these things through, communication, important, all right? So on the board here, and what you're seeing is that we have the oviducts, the fallopian tubes. They're ligated, they're cut. You'll see here also for the vas deferens, also known as the ductus deferens, also cut. And so if we cut the tubes, this then will affect what takes place as far as what could be the gametes moving through those tubes, right, and preventing pregnancy. Right? So you'll see here other barrier methods. So I mentioned the condom already, right? And know that just because you're using a barrier method is not a 100% guarantee. Now, I don't just mean this only for just pregnancy, but I mean this also for transmission of STIs, okay? And also, and I'm just going to tell you this, and again, this will get a little bit uncomfortable to say, but like oral sex, just because it's oral sex, doesn't mean if you're not protecting yourselves that you can't transmit different bacterium and viruses to each other. So really, there needs to be some wisdom and education regarding these things, because young people say, oh, well, I didn't have sex, I had oral sex. They don't even consider that sex, so to speak. Yet that's still pretty intimate, right? So barrier methods. So the condom, again, if you don't use these barrier methods correctly, can things still happen? Yes, yeah, they can. Cervical cap, covering of the cervix, smaller than a diaphragm. The diaphragm here a little bit larger, but these are all methods to block the areas so that the gametes don't meet each other. That's the bottom line. Act as a barrier, preventing them from meeting and causing fertilization to take place. The pills. So there are pills, there are patches. There are also contraceptives where the mini pill, where they can put an implant in your arm. So know that anything that we do, whether it's a pill, a patch, or having an implant within you, again, too, some people, there's side effects, and some people don't handle well the side effects, okay? So these are, again, also things that you need to consider, and know that there's also issues that can occur if you're on these contraceptives, as far as the pill, the patch, the implant. If you're on them for too long, could it possibly affect your ability to get pregnant down the road? So many people it's not a problem, but some people it is a problem. So realizing that, you have to really, so what I used to tell my my patients, right? So I've been teaching for years. I've been teaching for about 12 years here, but I have to tell you, really, in practice, I was teaching from day one, right? And even before, when I was in the clinic, as far as a student practitioner, teaching people that your health, right? Each of you that are here today, your health is not me as the clinician, as the doctor. It's not my responsibility. I will facilitate and do all that I can, if you are my patients, to help you and answer questions and guide you. But ultimately, who's responsible for your health? Or how about in my case, my own health? Isn't it me? Isn't it you responsible for your own health? So wouldn't it make sense that before you started doing something like this, right, you might want to do some more research and ask questions and figure out, hey, could this possibly cause some issues and such? And so you understand, like, it's really important for you all, and I don't even mean just this. I mean any medication or any treatment that you all might have to experience, or for someone that you love and care about that you're in charge of, so maybe a child, or maybe a sibling, or maybe a parent or a grandparent. Really, it's upon us all to, like, we have the internet, right? You know, we have the ability to really access information. I mean, to be honest, right, so at 57, I can't get over just like how the information that we have at our fingertips now in comparison to when I was even just first starting out in practice, and personal computers were like, okay, this is an interesting thing, but you know, like, still many people weren't really so savvy with using a computer. And then to have our cell phones, these little mini computers, so really research, look it up, figure it out, ask questions. You know, don't ever feel embarrassed to ask questions of your clinician, whether it's a nurse practitioner, a physician's assistant, a doctor, he or she, right? Doesn't matter. If you don't feel comfortable asking your doctor questions, your clinician questions that takes care of your overall health, then go to somebody else. Yeah, if they make you feel uncomfortable, yeah, choose somebody else, because your health is gold. I have to tell you that, right? So after my experience through this semester, right? You guys have seen me go through, like, whoa, it's been quite a semester for me health-wise. And I have to tell you that, you know, I had to, like, ask questions. I had to, like, try and figure things out with my clinicians, because, you know, now I come at it from a little bit of a different angle because I was already a doc, so I knew a lot of stuff already, but still, you know, I'm not a urologist. So there were still things that I didn't understand in now. But you gotta feel comfortable with your clinicians. And you know what? My family doctor was really supportive throughout this whole time. And I met with him a couple times, one online and one in person. And he was very supportive. And I really appreciated that, as far as helping me answer some questions and talk things through. So please, folks, you know that your family clinician, whoever that may be, and whatever, you know, if they're, like I said, nurse practitioner, PA, doctor, it's really important to discuss with them your health and feel comfortable that you can discuss with your health. In addition to issues, and many times it'll be, these are the clinicians that you'll be talking about regarding birth control and such also. Don't feel embarrassed. They're there to help you, you know? So yeah, I want you to understand that. Don't feel embarrassed, please. You know, like I said, and if you have an issue, choose another doc. Go to another practice. Now, there is this emergency contraceptive for the morning, called the morning after pill. It'll suppress ovulation, and really, it's there as a, you know, if there was an issue. So, in particular, thinking of people who are attacked or some type of, you know, possible rape and issues like that, but also can be for other issues. Also, you know, that's upon you and your belief system and your thoughts on whatever it is, and you know, that's between you and yourself and whoever you're with. I can't, myself or anybody cannot tell you what to do regarding that kind of a situation. The only thing I would say is just that, knowing that we know that, and I've talked to you about this before, that when that fertilization takes place, it doesn't become anything other than, as time goes on in development, anything other than a human. I mean, that's what's going to happen, right? We know that. We get that. So let's move on. So as far as infertility is concerned, right? So wanting to, get pregnant and having issues. And so the longer that we wait to have children, if we choose to have children, the more difficult it can be. So you should know that, right? So it can be a little bit more of a challenge. And whether it's on the male side or the female side, testing helps to figure that out. Okay, so going to a clinic, going to a physician who is a specialty in infertility. The thing that goes on with this is that this can be very expensive. I have to tell you. So from knowing patients as well as family members that have gone through some issues regarding this, this can really run into quite a bit of money. And so, there has, and it's a shame really. But, just that folks that have issues, but this is throughout medicine, that folks that have issues with certain types of problems within health issues, because of money, they're limited as to what they can do, and that's pretty sad. That's sad. I think that's sad, and I think that really, it's a shame. But this is still society, and even with free healthcare, even with free healthcare, folks. I don't know if you're covered under those that are your parents and such, or guardians, or you're paying for it yourself, or you're getting it through the state, or there's a lot of limitations with free. So free isn't just, oh, I get everything I need. So just know that also. It's something to keep in mind. You'll see here that artificial insemination, so taking concentrated sperm, placed in a woman's vagina, and actually they go more into the uterus and pass through the cervix around the time of ovulation, allowing for, and there are other methods and such, this in vitro fertilization. So you'll see here that fertilization takes place outside of the womb and then transplanted into the woman's uterus in order to allow for implantation to take place. And many times they're not just implanting one, but multiples to see what goes on. And so there's risks involved with these, right? And we've seen. I mean, anybody watch on TLC any of these shows where I've got like more than 2 kids? I mean, like they have multiple births and pregnancies and such. So it can be, and if you're not ready for that, that can be a challenge. So here we have, as far as the STDs, really, now we more appropriately STIs, because they're infections. And so you'll see here that many of them, folks, are bacteria, right? So these microorganisms that rapidly divide, right? And I have to tell you that these microorganisms like moisture, and they like areas that they're able to multiply very rapidly. And so getting tested to help prevent a rapid infection from going out of control and traveling throughout the reproductive anatomy, which can be very devastating and take, so getting it on early on if you have any type of symptoms, like I said, some of these don't even present with symptoms, they're asymptomatic. But if you do have a symptom where you're having issues where you're like, whoa, there's something going on down there that's not right, don't just say, I'll put it off and it'll go away. People do that, right? In all the years that I've been in practice, I've had patients come to me weeks and months later after an injury, after an issue, and go, well, I just kind of thought it would go away. Famous last words, so to speak, right? That's not wise. So if you have changes within your reproductive anatomy, get even as uncomfortable as it is. Hey, when I went to my whole procedures and such, it's uncomfortable. Your people are looking at your private areas there that you don't show to people, right? So it's uncomfortable. But wouldn't you rather be uncomfortable and be healthy instead of being uncomfortable or not uncomfortable and having issues progress, which could make you very sick? And as someone who cares for you, right? Golly, as your whoever your personal family members, they would want that for you. Absolutely. So chlamydia is one of them. It's one of the more common types of bacterial infections. This pelvic inflammatory disease, right? I mentioned that earlier today. This can lead to, so a serious complication of chlamydia or gonorrhea, which also is another bacterial infection, is one of the leading causes of infertility in females. And that's really sad. And I know of people who have suffered with this and became infertile. And oh man, you know, if fertility is not an issue, okay, but for those that it is an issue, it's sad. So here you just have examples of, and this is in here as far as looking at the different types of bacteria and such. So here, gonorrhea, another one. So chlamydia, gonorrhea, caused by bacterium. So how about this? Just to give you an idea again, right? Bacteria. So think like a strep infection, a staph infection. Those are types of bacteria. Okay. So here we have these bacterium that particular live within and can be transmitted between individuals as far as in the reproductive regions of the body. Gonorrhea, again, can have no symptoms at first. Symptoms evident in men, but not in women, right? So there can be issues as far as different types of secretions can come out of the male anatomy that would not be normal. Changes can take place as far as on the outer portion of the anatomy for man and female, right? But for female, maybe it'd be nothing. And so again, antibiotics, they can destroy now these bacterium. But know that there are some that are resistant, right? You've probably heard of like different types of infections like MRSA, right? That can be resistant to antibiotics. And that's a bad thing, right? Because then that's really a hard type of bacterium to kill and destroy and to treat as far as infection is concerned for the human body. Syphilis, this is another one, right? So this is a type of infection that can occur as a result of this bacterium that can really progress to a point where a tertiary syphilis, this can affect the nervous system and cause dementia and death. So Al Capone, I don't know if you've ever heard of that name, Al Capone. It's like an old-timey name, right? But he was a gangster, and he was in prison, and they were able to, he was a bad gangster involved in bad things. And he went to prison because of tax evasion, because that's what they were able to get him on, as far as to get him into prison. And he died in prison, I believe, as a result of syphilis. So know that syphilis can go undetected, untreated, and it can, and here's the thing with syphilis, right? So you can have symptoms and go, oh, that's kind of bad, and then think, well, maybe it'll go away. And you know what? It'll go away, the symptoms, but it's still present within your body. It's just going from one stage to the next, and that's bad. Because when it progresses further and further, it can get to this tertiary syphilis where you'll see here, lesions and scars develop on the internal organs. It can affect the brain and cause damage to the brain and spinal cord, and it can lead to mental health issues and paralysis. That's crazy, right? For a sexually transmitted infection. So nothing to play around with, nothing to just say, oh, it's going to go away on its own. Very, very, and you know, so images there. These are called chancres, right? These sores from syphilis. All right. Now, viruses, parasites also can be passed on from one partner to another, okay? Herpes, genital herpes, so caused by a virus. There's type 1 and type 2. So type 1, notice that, like, you know, issues with like the oral cavity, also the eyes. Type 2, more along the lines of the genitalia and such, okay? And again, viruses are difficult to treat. And so we treat outbreaks of these viruses, but, you know, can they be fully cured from these viruses? Very difficult, very challenging to treat. HPV. So HPV and hepatitis. So there are vaccines available. And notice these, so these are not vaccines that are mandatory, but that you need to make sure that, is this right for me? Is this right for my my children? Only you as a guardian and as the guardian of your own self can determine whether, and I'm not anti-vax, know that, right? So I got vaccinated with the corona, COVID and such, and I was, pretty much most of, my vaccinations are current and such, and also so I'm not anti-vax, but I'm of the mind of that you should be educated and make choices that are educated choices, no matter what it is regarding treatment. That's what I always told my patients and what I tell you as students. Be educated about what you put into your body. Don't just accept anything that somebody says, but educate yourselves and make sure you're doing the right thing for yourselves and for your loved ones. Okay? So there are these viruses that we do have vaccines for. And so know that, these viruses can be really, really virulent and really cause quite a bit of damage to the body. Okay, so, definitely, like I said, and can be sexually transmitted. And so we should be aware of what's going on with them. You see here also Hep B, Hep C. You see here as far as STDs, as far as parasitic. So you'll see here as far as pubic lice, as far as yeast infections and such. So these also can occur and be passed on from one partner to the next, and be very uncomfortable. So say the parasitic and the lice and the yeast infections, it's not going to kill you, but it can really make you quite miserable, to be honest. Okay. And trichomoniasis. Okay. So this is another one where can cause severe inflammation within the female reproductive tract. And really know that infections can be passed back and forth between, if the infections are not treated on both ends of, so if you're both partners need to be treated, not just the one partner. Okay, so really important also. So you're seeing some little critters there. Okay, so some recommendations and such, and again too, this is not meant to think like, oh, you don't know this already, but just as a reminder that this is important. So really, again too, we mentioned about abstinence. If that's for you and what you want to do, that's the most foolproof, right? You abstain from relations, but if you do choose, right? So then make sure that you're being wise, that there's communication, and that you're doing whatever it takes in order to protect yourselves, and also getting tested. Really important also, okay? And so that whole thing there as far as discuss sexual history with a potential partner. Because again, realizing that, you need to communicate and realize that, hey, if you've both been active, you should both know what's gone on with each other and such. And if you care and love someone enough to have these intimate relationships, then you should also care and love them enough that you'd be willing to communicate. Be alert of sores, discharge, or other problems. Anything that's different that's taking place in your reproductive anatomy, aches and pains, any type of discharges, any type of sores, get them checked out immediately, right? It's so important. And why does it say you avoid using alcohol and drugs? Because know that, and you get this also, people who are, using these different, whether it's drugs, whether it's alcohol, right? And again, alcohol is legal, the drugs not really, weed is legal now, but realize that whatever it may be that's going to be a mind-altering type of situation or affect your ability to make decisions correctly, we've all seen in the news, whether it be online, on TV, on the radio, of people who have been involved in date rape and issues where they've gone to a party and they've been given a knockout drug, or I forget, roofie or something like that. Or just the fact that, hey, maybe you had a little bit too much, and then you did something that maybe you wouldn't have done if you were, in a better frame of mind. So it's not a judgmental thing. It's more of like, protect yourselves. You understand? Protect yourselves. Be careful, because the bottom line is The only one that's going to be able to protect yourself in situations, and that is yourself. And if something does happen that's not acceptable and not what you wanted to happen, then you need to go to the authorities and make sure that people know and report it to the police and get examined and get checked, so that this way, so somebody who does this bad thing should not be able to continue to do this kind of a bad thing and abuse others, because abuse is never acceptable from a man or from a woman, right? It's never acceptable. And protect yourselves, please. Be careful. All right. Yeah, and so and as far as those pills are concerned, right? The birth control pills. So whether it's progesterone or whether it's estrogen and progesterone, whether it's the mini pill, which is only one hormone, or both hormones, there's ways of taking it, and if you miss taking it a pill one day or something, you could really mess things up. So you have to really follow the directions exactly. Okay, that's important. And if exposed to an STD, avoid sex until medical tests confirm that you're not infected. We do get this as far as when we talk about COVID. I mean, we've been very, careful, many of us, with trying to prevent ourselves from passing it on to other people and such. Well, remember too, with these kind of situations where if you possibly were exposed, well, then do the right thing by making sure that one, you communicate with partner or partners, and that you abstain until you make sure that you're okay, and that others, yeah. So that's just only a courtesy type thing, and just makes sense that you're thinking about others and not just yourself. So we'll end with, and let me just see for a moment here, just I can go over. Excuse me one moment. Yeah. So we just have a couple more slides to go through. Okay. So maybe how about in classroom here, and you all at home, why don't you take a moment and just stand and kind of just stretch it out a little bit if you want, or just have your seats just stretch, but we just have a little bit more to go and we'll be done with our presentation today. Okay. I know it's not easy to sit here and to listen to Dr. Perrone go on and on. I try to make it interesting for you all, but I get it. I understand. Go ahead. Yes, question.
I mean, there are far worse things to talk about than STIs, uncomfortability, like Zika. Like Zika.
Yeah, understood. Yeah, and yes, and so that I find it I see pathology as very interesting, and so that's why I do provide at the end of our semester that you all take the time to do a project, to do a paper regarding some type of pathology. It just kind of makes it a little bit more real to you. And I've tried to share with you, these different pathologies as we study the different body systems, so that it becomes a little bit more real to you, because you might know someone who suffers from bronchitis, from asthma, from any of these issues that we talked about throughout the semester. And even you all might have suffered from something, we all end up suffering from respiratory type issues like a cold virus, or other things like that, or even COVID virus, right? So pathology is a necessary part of when we're studying the anatomy, human anatomy and such. So here we're looking at, as far as knowing that genetics, and you all, I'm sure, have thought about this or heard this, and if you haven't, we've been able to determine genetically what can be passed down from one generation to the next that could possibly make you more susceptible to, in this case, breast cancer and such. My mom who's 79, she's a survivor of breast cancer as well as uterine cancer. So, cancer is something that hits many people. Actually, I would say that most people in their families can at least name one person that's suffered with cancer to some extent. Whether it's life-threatening or not, right? Cancer is rampant, and so instead of just throwing up your hands and going, oh well, I can't do anything about it, there are things that we can do as far as testing and seeing, hey, am I susceptible? I mean, they're whatever you may think of it, there are some people who are at high risk who have even preemptively, had mastectomies done in order to really minimize their chances, and then had implants and such used. So everybody's got to make these own personal choices for themselves, but testing, chances for survival, best if detected early. This is for any type of cancer, whether it's prostate, whether it's colon cancer, any of these cancers, early detection, really important. So uterine, ovarian, right, as well as breast cancer, and like I said before, prostate cancer. These are all areas of the body in the reproductive anatomy that seem to be very susceptible. And I would tell you that as far as prostate cancer, so testicular, but prostate cancer, second to lung cancer in causing death in men, right? My dad just finished up treatment before Thanksgiving. He went through 8 weeks of radiation therapy, 5 days a week, going to the clinic and having that done in order to destroy the cancer cells within his prostate. If you live long enough as a male, you will have some type of issue with your prostate. That's a guarantee. It's like in the 90 some odd percentile. It's a crazy number. Like if you live long enough, you'll have some type of issue. Now it may not kill you, but it'll definitely make life more challenging for you. So that prostate gland, for whatever reason, is very susceptible to cancer cells and such. And know that cancer cells, these are cells that are mutating. They're your own body cells. They're within you, but as a result of mutation and mitotic division, right? Those cells divide and they produce more of these cancer cells. That's why, and they're rapidly dividing cells. So production of a tumor usually is pretty fast growing. Now there can be slow growing tumors, okay? But fast growing tumors can really be devastating to the body and spread, metastasize to other areas of the body. And so this is nice to end off with this slide here in talking about the fact that, so egg donation, providing eggs, oocytes, for use in fertility clinics, involves providing detailed life, educational, medical history, right? Excuse me. But realizing that for those that have issues, this might be a way that you could provide something for others that could enable them to have children. And that's pretty cool. So if that's something that you're interested in doing, I know for myself, as far as, I'm a male, so no egg donation, but how about in just the overall body situation, like I have on my driver's license that, I'm an organ donor, right? So I'm not donating my body to science, so to speak, to have them cut them up and whatever, but they can, if I'm in an accident, if there are issues where, they can harvest whatever they may need in order to help somebody. And if you have a family member who has received a donation, an organ donation, whether it be a cornea, whatever it may be in throughout the body, how happy you are that your very sick relative was able to receive something, a donation, organ donation, as a result of someone being willing to give of themselves. So I think that's pretty cool. I think that's really pretty neat. All right, gang. So I'm going to stop recording.